Hey, what's up? Welcome to In Between Briefs, a show by House of Panache, where we tell you what we do in between briefs. Kuna wase wanatupatia, unajua venye watu wako in between jobs. Us guys are always in between briefs. We've just taken a break from some campaigns we've been doing, and we're very, very happy you joined us. Karibu sana. Today we are talking about FGM, and for us, when WHO approached us to talk about FGM, we worked on zero tolerance for FGM, and we, after now tulijua what FGM is, we were like, oh my God, there must be zero tolerance for this. And from day one, we knew this wasn't just a message, it was a movement. The task was very clear, inform, protect, empower. We built a campaign that cut through the noise and spoke directly to the truth, that no girl anywhere should go through this. Not here, not now, not ever.
Yes, I'm perfect. Please let me be a woman.
Through powerful visuals, as you can see, survivors' voices and community engagement, the campaign created a space where silence was broken and action was demanded. Because of the end of the day, this isn't just about awareness. It's about impact. It's about protecting futures, and it's about saying with no hesitation, zero tolerance means zero tolerance. Check out this documentary we did, and then we'll tell you why we do documentaries at HOP.
Female genital mutilation is a harmful and deeply entrenched practice that has no health benefits and often causes severe and long-lasting physical and psychological harm to the women and girls who undergo it. Together with WHO and partners that support ending female genital mutilation, we are saying louder, enough.
My name is Catherine Chacha. I am a health worker. I am here for zero tolerance, a call to action to end the practice of female genital mutilation.
This practice needs to end, and not just today, it should have ended long time ago. As a healthcare worker, I have gotten an opportunity because they have that trust in me, especially in the community that I come from. The Maasai girl child specifically, they have dropped out of school after FGM.
Health workers can play a vital role in ending the practice of female genital mutilation and supporting girls and women who have undergone the practice.
Even those girls who think that their parents are planning to take them through the ritual are able to approach us as healthcare workers, and we are able to meet the parents, talk to them, advise them that this practice is not good.
Na pia tunazungumzia juu ya ukeketaji wa wasichana na tunajaribu kuhimiza watu. We will work together, steady and fast. Everyone, this time with the voice of men and boys too.
We're working with health providers in many countries to stop this harmful practice and to ensure women and girls who have already suffered FGM receive quality health care tailored to their needs.
We will partner with all who are fighting FGM to bring about a world where every girl is free.
My name is Professor Patrick Ndavi Moya, Professor of Obstetrics, Gynecology and Epidemiology, based at the Department of Obstetrics and Gynecology, Faculty of Health Sciences, University of Nairobi. I'm also the coordinator of the Africa Coordinating Center for the Abandonment of Female Genital Mutilation. It's a center established through Senate statutes. If you have probably 10 girls and women who have undergone FGM in the recent past, you'll find 8 to 9 of these have undergone through female genital mutilation by the healthcare workers. So it's a must. We must bring in the health sector. 2, the health sector and the healthcare workers have that competitive advantage of meeting with communities. In counties in Kenya, for example, or even in countries, whether Senegal, whether Guinea-Conakry, whether Egypt, whether Somalia, Sudan, healthcare workers come into contact with communities and populations. the health sector needs to be empowered to begin sowing the seed for ending FGM.
The WHO has been very key to ACAF on this End FGM program. They've helped us throughout the years. WHO helped us come up with the handbooks. They helped us come up with the guidelines. They helped us take these guidelines and handbooks all the way to the far-flung areas where FGM is rampant.
So we went through the manual which was also developed by World Health Organization, Geneva, with inputs from different stakeholders. Now we have that manual on person-centered communication for the health sector to know how to broach the subject of female genital mutilation during routine clinical care. And that has also informed the content of the curriculum that ACAF has developed and is implementing.
I would really like to thank WHO through ACAF, which trained us how we are able to handle our mothers who come to the clinic concerning the FGM practice.
And working together, midwives and other health workers can help end female genital mutilation.
All of us as healthcare workers combine effort, we can continue teaching them because knowledge is power. The more they hear about ending FGM, the more we have that impact to a point that we will reach a 0% FGM going on the ground.
Ending FGM is our ultimate choice. Let us make female genital mutilation a distant memory. A practice of the past, no longer a reality.
Health workers can plant a seed of hope of a future without female genital mutilation. So let us rise and join hands and support the health workers.
Please let me be a woman.
Let me tell you, I never liked documentaries. They are so long. But honestly, how would we have said that in a 30-second or a one minute ad? When I started this, I was hoping that I can use my skills to highlight the ills of society and to highlight people who are going through unfortunate times and the pain in the society. I believe I come from that. I'm part of every Kenyan that goes through any pain. I'm part of that. And one thing we're trying to do as much as we can is to do documentaries. Why? Because we don't just make ads here, we make documentaries that matter to people. Because in a world full of noise, a documentary is proof. It's culture on record, it's impact you can't scroll past. We do it to show real faces behind the data, to give movements momentum, and to create legacies that last longer after the campaign ends. So if your brand is out there and is ready to go beyond a 30-second TV commercial, let's make a documentary. Let's tell the story that sells today and still matters tomorrow. But next week we'll be talking about Gold Star and how USAID made sure tukuli tena. Shukrani kwa kuwa na sisi. Keep commenting, keep joining our conversations through our YouTube channel. We can grow so many things. You can tell I've grown a bit fat, but we can grow our YouTube channel without you. So please subscribe and tell people of what we are doing. Asante sana. This has been In Between Briefs. My name is Vieira. See you next week.